Good evening, friends. Welcome, welcome, welcome. Welcome to this episode of Miraculous Mondays. And I am before you presenting the 11th episode in this series. So I'm late today by a couple of minutes, but the network was a bit dodgy. So that is the reason I duly apologize for that. Usually I try to be on time. So today's topic is about a very interesting query taken up by put up by my group participant from my WhatsApp group. So I'll be sharing the same and answering it in my own way, of course, as I usually do. As you know, there are not much of slides in these sessions in my these lives on Monday. They're just about a few pointers only. The more of the thing that comes directly from my mouth only and not exactly visible on the slides. But still, however, as a you can say part of the protocol, I'll be sharing the slides, so please allow me to share the same, please. Thank you. Allow me to share the same. So welcome officially to episode number 11 of 26. Today is Monday, 14th of March, and we are here for this weekly live session on the topic of practice management or medical legal, whichever comes suitable. Of course, next week I'll be taking up a medical legal topic, which I put up in my WhatsApp groups for detailed discussion. So let's begin today's session without much ado. So as usual, all my presentations will always begin with thank the Lord Almighty, who has given me much more than what I deserve. So this is my brief CV. You all are aware of it by now, so I'm not spending time on it. So this was this was from where the query came up. I run two WhatsApp groups, as you all know, two groups on practice management and finance, and again, one of my ways of paying back to the society along with my YouTube channel. So these are two, you can say six groups which are running. I plan to limit them to six, and the query came from group number one. So what was the query? The query was that sometimes, despite all motivation, infrastructure, gadgets, and skills, patient does not come just because of cost factor. Is there anything we can do to guess whether patient will afford such treatment? Or should our charges be the natural filter, those who appreciate, deserve us, and rest can go to cheaper options? So, Dr. Shrikant Rao posted this query. I told him it is very, you can say, it would be wrong to answer this question in text mode because it would be injustice to such an intelligent question. So this actually came after my my Sunday morning session, which I had taken up on motivation and 5 ways to self-motivate yourself. And after that question, that is where it starts from. Despite all motivation, we have all the things in this world, and the patient doesn't still get converted because it started from all that we should be ourselves motivated for the conversion part before the patient is motivated or before the patient is persuaded to go for the conversion in our treatment part. And for I don't know why people have this notion. They have this mindset कि सब कुछ सस्ता ही बिकता है. Whenever they have problems, they say Mercedes and Audi तो दूसरे लोग खरीदते हैं. The very super rich people, they don't fall in the common man's category. And then sometimes there is a question of who's giving a warranty or a guarantee. Of course, I'll be taking that up in the next MLE session pertaining to the query going on currently in the groups, in my WhatsApp group, I mean. So I'll take to that. But simply speaking, whenever the question of warranty guarantee comes, they start comparing themselves to a cardiologist. Does cardiologist give a warranty? Come on, first of all, see your level. You may be highly skilled, you may be perfect in your work, but comparing a graduate to a super specialist is a stupidity in itself. Don't do that. Why don't you want to compare a chalk to a cheese? I'm not saying who's chalk and who's cheese, but this is not like that. Tooth ke bina logon ka chalta hai. We all know how much population gets the treatment done in India. Heart ke bina logon ka nahi chalta hai. So how can you even make a comparison of a cardiologist and a BDS or a dentist, I would say? This is absolute bullshit. Sorry for my language, but this is one point I never buy. I never even debate on it. I never even stop to reply back to such queries. but this is the way it is. Of course, I'll address that deeply in the next issue. But let's stick to ourselves, that we are wanting to get a conversion done. We have all the motivation. We have all the, you can say, teen tappat, all sara tam jam. We all that, we have everything with us. But then the patient asks the price, and ultimately the result is, okay, doctor, aapko soch ke batayenge. And the patient walks away and never comes back. And what can we do? So let us actually take this thing forward and try to judge it in a way that what can be the best factor for us. So Dr. Shrikant Rao, thank you for this question. Let me just answer it in my way. So the first thing I want you, all of you, to understand that everything in life has its price. There are no free lunches, and the only thing free, with due respect, in this world is the mother's milk. That is the only thing that is free. Nothing else comes free of cost. So everything has a price. So if you sell yourself short, then you are committing a mistake. If you sell yourself according to your lab charges, you are again committing a mistake. If you sell yourself according to just your material charges, you are committing a mistake. I have stressed enough upon the importance of indirect costing and direct costing in my lots of sessions previous years. So I'm not wasting much time on telling you what is the direct cost, what is indirect cost. Still, the mindset is such that people will look at the lab price and then sell their crowns or whatever product. They forget to make a differentiation between what exactly is worth and not. Their own education, their own hard work, their own nights spent, you can say, their own struggles are forgotten conveniently in the eye of competition. Rather than, you can say, stooping to, you are giving at 2000, I will, my neighbor is giving at 2000, I will give you at 1800, philosophy is again stupidity. It's rather better that you network with all the people in your area, I mean the dentists, and make a group that you all will not charge minimum below that. But then the price war is the even immediately the neighboring dentist, without going to his clinic, without even meeting him sometimes, वो हमारा दुश्मन, जानी दुश्मन बन जाता है रातों रात. I don't know how. उसके क्लिनिक के अंदर के मटेरियल्स घटिया हो जाते हैं बिना देखे. I don't know how. उसका काम करने का तरीका गलत हो जाता है बिना उससे मिले, बिना उससे बातचीत किए. I don't know how. But these are the perceptions that are made by us. And this has absolutely no grounding in terms of that, and still people have that logic of the pricing and part. I don't have any debate. Of course, I'll be dealing with that. So what gives me a little bit of validation is I have written a book 2 years back on this topic. Of course, the second edition is due to come most likely in the April. It will be the Indian edition, so it will be available. So I know a thing or two about pricing and charging. Lots of methods that were discussed in my book earlier also. Now the new version, the second edition, will have lots of anything. It won't be published by Lambert Academy. It'll be self-published by me. So what I have tried to stress upon in this is that the price philosophy has to be conveniently forgotten. There are many other factors. People don't know it. वो वारंटी गारंटी की कार्ड आती है, वो कार्ड को पकड़ लेते हैं, खबरदार वारंटी दी तो. अरे, why do you want to sell the warranty? Why do you want to sell those things? It is beyond me. Of course, I'll discuss those in the next one. So the first part of the question was infrastructure, gadgets, and skills. Patient does not come just because of cost factor. Really? Why? What is the reason? The thing is, most of us are not actually interested in going to our outside area. Immediate vicinity, I mean, immediate into our society, to our locality, to our mohalla, to our, so you can say wherever we are practicing, we fail to meet people around us, people who can give us referrals. And immediately what thing comes to your mind? The first thing comes to your mind is the shopkeepers, the local shopkeepers around you. Those who have, you can say, a steady flow of traffic. It is a halo effect. People, when you go and meet people in a properly dressed manner, they will form that perception. Yeah, doctor khud chal ke aaya. He was dressed nicely. He talked nicely. तो ये काम भी अच्छा करता होगा. That is the halo effect. That is the perception. But then the mindset becomes, नहीं, उसको कट देना पड़ेगा, ये करना पड़ेगा. Why does a local shopkeeper need a cut? जिसको कट चाहिएगा वो खुद आपसे आएगा, डॉक्टर साहब मैं आपको पेशेंट भेजूंगा, मुझे कट दे देना. Refuse it straight away. Why do you fall into that trap? Trust me, one very nearby chemist, very reputed chemist in my area, that uncle, now his son is also a little bit elder than me in age. His father, I mean, uncle came to me for treatment in second or third month of my clinic, way back in Feb, March 2000. And luckily he was satisfied. And trust me, he sent me so many referrals, especially in the initial phase of my career when I was doing only half day practice for first 3.5 years. So he sent me a lot of referrals. Never did he even ask for a cut. He is anyways very ethical chemist. He never substitutes drugs, or you can say always ask me prior if has to change even the salt I've written. So, or rather, sorry, the trade name if I've written any. So he's that ways. So why do we expect that every chemist would be like this? I didn't know him before. He didn't know me before. It was a mutual thing. Now, whenever I go, he gives me a regard, and you can say gives me a 10-15% discount and whatever. I don't ask for it. He gives it to me. So whenever he comes or his family comes for treatment, I make it a point that I do return back the favor in whatever way I can, by over delivering the service, by maybe giving a little bit of a, you can say, discount part maybe. Normally I don't do it, but for special people I always do it. But this is the way the relationship becomes mutual. But then लोग क्लिनिक खोल के बैठ जाते हैं, सिर्फ इनविटेशन के टाइम पे बोल देते हैं. They don't go out there and meet people, and then they say हमारे पास कोई आता नहीं है. अरे आपको आपके दुकान का, क्लिनिक का बोर्ड पढ़ के थोड़ा ना कोई आएगा, आपके क्रेडेंशियल्स पढ़ के सिर्फ थोड़ा ना कोई आएगा. वो वॉक इन आएंगे. But those who come, they will be referrals from such people. They'll be still having some firm grounding. So you need to realize that part. So the mindset is going to be very crucial here. When the patient walks in, let's suppose the referral part is done now, the patient comes in, or maybe any walk-in patient is done. He's heard from someone that Dr. ABC or whatever, I mean, I'm referring to you who's listening to this presentation. Let's suppose you're Dr. ABC. Dr. ABC, मैंने सुना आप महंगे बहुत हो, but I want to still consult. People will never mind paying more if they can conclude from your words that they will be cared for. अब ये आता कहां से है? Your talk, walk, and how much you stalk. Not literally, please don't take the stalk word literally. What I mean to say, I'll explain, of course. So your mindset, how you talk to your patient. People are busy. मैं boss हूं ना. I am the best. I know better than you. You are the patient. You should listen to me. There is hardly an interaction kind of a thing. Then we jump on to the conclusions immediately. We don't let the patient even finish. वो ठंडा पानी पीने से relief मिलता. We know it. We know it since the third year. But let the patient speak first. More than 80% of the patients, not the dental, but the medical and dental combined in India, have this complaint. डॉक्टर ने हमारी बात ठीक से सुनी भी नहीं. सो ट्रीटमेंट क्या देना है अगर बात ही नहीं सुनते? अपने गीत गा रहे हैं, अपने सिखा रहे हैं, मैंने ये किया, मैंने वो किया, मेरा ये केस है, हम देखो ऐसे करते हैं. Boss attitude, singing your own tunes attitude, perfectly fine, do it, but there is a time, there is a sequence, there is a, you can say, a methodology to do that. It is not that patient आया तो आपने धन्ना सेठ बन के उसको सब कुछ impress करने पे लग जाना. It's not like that. So if they understand that they will be cared for, now where does that care factor come in? When the patient asks you and his queries and his doubts are genuinely answered to the, you can say, to the hilt, to the finest detail possible, the patient will make an assessment. इस बंदे को बात पता है, इस बंदे को काम पता है, इस बंदे को अपना काम आता है. नहीं तो the commonest attitude is, आंटी आप चिंता क्यों करते हो, मैं बैठा हूं ना, I'll do it. That attitude, बैठे तो ऊपर, please answer my query first. But hardly people take a step to, you can say, make an effort or a dedicated efforts towards that. And that is where the pitfall comes. We are not ready to spend the time in consultation. We are not ready to spend the time in an interaction. We don't want to listen to the patient's problem properly. And then we don't want to, you can say, suggest a treatment plan, let the patient sleep over it. Sometimes we jump onto the treatment in the same sitting. वो mindset ही है, थोड़ा सा करके कुछ पैसे जमा करा लो, patient अपना हो गया. That is a wrong mindset. For a smaller procedure, you can immediately start after the verbal express consent, of course. But for a longer procedure or even a medium ticket procedure, you need to give patient time, or you firstly need to take yourself time. You need to go in for some investigations, OPD, CBCT, or whatever. You need to do that. Sleep over it. Write the treatment plan. Write the treatment plan, sleep over it. Morning उठ के सबसे पहली चीज वही देखो. That and try stepping into patient's shoes. Don't suggest a treatment plan based on your EMI due, which is your due EMI this month. तो उस हिसाब से इससे इतना तो हम इतना फटाफट करके इतने पैसे जमा करवा लेते हैं. Our whole treatment sometimes revolves around that. That is where you miss or start to miss the authenticity part of the same. You will lack genuineness when you say, sorry, the patient. मैं हमेशा यही बोलता हूँ. Imagine the patient walking into you for consultation is your third patient. Or sorry, you are the third dentist for the patient. The first maybe is original dentist, जहां से वो सोच के पढ़ के लिख के सब कुछ आया है. He might not portray the same to you. The second is Dr. Google. So you have to give an opinion which is verifiable, which should be authentic. Trust me, I have become the first dentist of so many after being initially as their third dentist. But your talk, your walk, जो बोलते हैं ना attitude कितना आपसे बात करने के टाइम पे patient, that actually sets you apart. And then if the patient has taken up a time, how much you talk. If you have answered the doubts in full, they will themselves call. Or if not, call yourself once. We don't see. Patient को जरूरत होगी तो खुद call कर लेगा. That is where we commit a mistake. We need to forget this. We need to have to shun this attitude. You are the boss, of course. You are the owners of the clinic. वो patient ने आपके पास आके registry नहीं करा लेनी clinic की आपके नाम पे, अपने नाम पे आएंगी. So you are the boss. He also knows it, but you need to understand that part. It doesn't work that. So the second part of the query was: is there anything we can do to guess whether the patient will afford such a treatment? In a lighter way, Shrikant, don't mind, please. Palmistry, astrology, and tarot card reading are the options, which can actually make us, you can say, guess whether the patient will be able to say a yes or a no. The patients always make a decision based on their informed choices. When they have been given choices, their doubts have been answered, their, you can say, a mental satisfaction level has been achieved. It doesn't take hard enough to say a yes. I recently completed my practice management workshop when I was teaching almost these things, many of these things and extended concepts in that workshop. Trust me, in those days, when I was doing, the workshop was in the afternoon from 2 to 4, 2 to 5. So when I was doing consultation in those days, what I was teaching actually made me a little bit more conscious. But what I've taught, of course, I'm already doing that. But what I've taught, I have to do that a little bit more speaking. And I saw those conversion rates further go up in terms of patient taking time and in terms of patients getting conversion. I remember I gave an example. A patient got a detailed estimate from me worth 45,000 or so and said, okay, doc, he's just lives at a walking distance from me. He went away at 7:30. He said, doc, I'll call you before 9 p.m. 7:38, he called me up. He 2-3 मिनट उसको जाते लगे होंगे, वाइफ से डिस्कस भी किया होगा. 7:38 उसका कॉल आ भी है. So that was that far a quicker conversion. Of course, before that, I had spent 7:05 to 7:30 with him, 25 minutes on the treatment plan part, because I had already taken up the time to discuss that. So how can you judge or how can you guess whether the patient will be getting the treatment done from you or not? Trust me, patients can convey a lot of emotions or maybe stone-faced. The stone-faced are the ones usually which are your, you can say, for whom you are the third dentist. They're actually verifying you silently. बोलो बेटा, सुन रहे सब सुना हुआ मैंने, देख रहा हूँ तुम क्या बोलते हो इसके लिए. They are like judging you in that sense. Many times when we are singing our own tunes, we forget to observe the body language. You have to literally train your mind that when you are speaking, your one eye should be on the patient, and the patient interaction, when you see, it is not getting distracted. You are the best. That is why for that big ticket case, the patient has come to you for consultation. You are one of the capable candidates. That is why the patient has come to you for you can say consultation. But telling or having the same template, पहले patient आएगा, उसको ये बोला जाएगा, उसको ये दिखाया जाएगा, फिर उसको ये दिखाया जाएगा. That template does not work. You may have a template, but it should be a flexible one. Some patient may not be interested in the materialistic models of crown and bridge, or maybe whatever you're trying to show. They may want to see a before and after. They want to see how many cases have you done. They want to see what is the troubleshooting. Especially the aesthetics part is involved. What is the, you can say, your payback in that regard? How are you going to take care in that part? So when you can say, apne geet ga rahe hain aap, to your one eye should be on observation of body language. The patient is like this, you can say, getting distracted, looking here and there, making body gestures, body movements. You need to see that the patient is out of the conversation before you have started singing your tunes properly. He's out of that. So you can say another key would be tell the staff also to keep noticing patient's attention span. The staff should make a gesture to you. But कई बार वो खाब लैंड में या बोलते हैं ना सुनने वाली या गाने वाली लैंड में पहुंच जाता है, तो we hardly realize that. So always keep your own tune singing to minimum. Nothing wrong in it, but the patient is listening. But अपनी तारीफ करने से अच्छा patient आपकी तारीफ करे, वो that is more credible. I don't find anything wrong in that, but I trust that this is a better, you can say, way where we can expect that the complaints are given a resolution in that regard. So I am the best, of course. You are one of the best. That is why the patient has chosen you. But that attitude should be, you can say, limited to a minimum part. Your tune singing should be limited to a minimum amount of part. And you should know where to put a break. अगर हर फिल्म में रोमांस एक्शन डांस होता तो सारी फिल्में एक जैसी हो जाती. We need to know where to stop and where to start, and we need to have a backup plan. That is where I always tell participants, especially in my workshop also, to do a role rehearsal, role reversal. How you do it? You have to practice the consultation. If you find no one in your family, do it in front of the mirror. Be a patient in the role reversal part. What is in your mind? What the patient knows, or what the patient can have a common question. That can only be known by you if you know your art, know your trade very well. But if you don't know, then you can say you can shift to that. So the third part of the question was, should our charges be natural filter for those who appreciate, deserve us, and rest can go to cheaper options? I would say point to hai, Guru, in the language of our Navjot Singh Sidhu ji. So point to hai, but yes, there is a flip side to that also. Deserve or not deserve comes from your own natural talent. Natural talent does not mean I have a good convincing power. आपकी तो convincing power अच्छी है, आप convince कर लेते हो, मैं नहीं कर पाता. If I tell you I have one of the poorest convincing powers, it will come as a shock to you. But that is a fact. I have a very poor convincing power. मैं अपने घर वालों को कई बार convince नहीं कर पाता हूँ. तो patient को तो एक separate matter. That is a professional matter. But then poor convincing power should never be an excuse. We all have some innate inner power in it. Unleash that to fullest. Some of us may be, you can say, good in detailing. Some of may be good in presentations. Some of us may be good in talking. Some of us may be, you can say, having a skill in interaction. There are multiple things. Find out your inner power. Find out your innate power and unleash that to the fullest. Of course, you have to draw a template that these are the steps for a template. If the patient does not want a step 2, let's skip to step 3. If the patient does not want a step 3, let's skip to step 4. For the patient, the audio video aids are always a handy thing in patient convincing, but they are not the be it or the end of all. You need to still talk. You need to still answer patients' queries to the finest details possible. Don't get irritated. Develop some patience in that. Listening is an art. Sir William Osler from England said, listening is unspoken caring. So if the patient feels that you paid proper attention to his problem via listening, by paraphrasing what you were saying, or you can say by summarizing whatever he said, you will automatically get brownie points that you are a caring dentist. कम से कम बात पूरी सुनी समझी, then suggest. If you are still not sure, you want an investigation, ask for it openly. Ask for it openly. There will be still crooked elements who will say, आपको इतने से पता नहीं लगता है? Sir, नहीं लगता सर, नहीं लगता. Accept it. Many times making a false diagnosis, a wrong diagnosis, and then eating your own words doesn't bode well for practice. Buy some time if you can't do a consultation. Use diagnostic aids, as I suggested, your OPG, CBCT, or whatever you need to buy some time. But then don't, you can say, unnecessarily advise those if those are not needed. But you need to understand a case before you jump onto the conclusion. Your words should be very measured, very calculative, and very thought of when you speak in practice. Sorry. So the price, it is a good question. Sorry. The price is always a good question. End of the day, we can say, सारा कुछ patient ने सुन ले, लेकिन फिर भी उसने कहा the price. There will still be some patients who will not be satisfied, can say, after all the care part, you can say, or whatever you have to offer, and still it will boil down to price. Fair enough. Who said conversion ratio after a good consultation is 100%? It is still 72%. So that means every 100 patients that walk through your door, only 72 of them get converted. Of course, it may be more, it may be less in your case, but that is the ideal conversion ratio. So not everyone walking through your door is your patient. Some will choose someone else for a price. That is perfectly normal. But every patient is doing that. You need to realize that maybe something is lacking in consultation and your treatment planning, and not necessarily, or maybe in your communication, of course, and not necessarily the price. But अंदर कोई आएगा नहीं, जहां से मैंने स्टार्ट किया था, अगर नेटवर्किंग होएगी नहीं, अंदर कोई आएगा ही नहीं, तो बात किससे करोगे आप? That is the question. So we started from here. Despite all motivation, your skills, the patient doesn't come just because of cost factor. You have to network. You have to create your own space. You have to create your own space for reference. I really don't understand why all of us are fanatic about new patients. The old patients, or the retention of old patients, is a bigger trier for all of us. Remember, if you have a clinic SOP, and or maybe a system of working, the old patient is already, you can say, knowing all that. But your new patient has to be told, primed up, prepared, and adjusted, or you can say overhauled in our setup, in that कि हम लोग ऐसे काम करते हैं, आपको ऐसे आना पड़ेगा, these are your instructions, this is my consent form. All those things have to be worked upon. And for the old patients, everything is ready-made. We hardly, and they are satisfied. If they are satisfied and loyal patient, they are going to send you multiple referrals. And if the referral comes through them, वो भी already prepare होके आएगा. Somebody refers to my, you can say, my WhatsApp groups. वो बोलता है, उसको पता है सर मैंने rules convey कर दिए हैं, please इसको add कर लो. I still send the rules, but that is an SOP. मेरे को बताने की जरूरत नहीं है. I don't advertise and I don't create invite links कि मेरे को numbers दिखाने किसको. I've never been that guy. Whom I am to show? मेरे 20 WhatsApp groups है. 20 WhatsApp groups manage करने के लिए time और हिम्मत भी चाहिए ना, मेरे पास नहीं है. I plan to limit them till 6. Beyond that, 6 भी इसलिए I type in 1 and then I can forward in 5. That is why 6. It is good number. वो lucky number नहीं है. ठीक है, मेरा date of birth भी है, but it is not a lucky number in that regard. I keep want to. That is the WhatsApp. अगर कल को WhatsApp कोई कम ज़्यादा करता तो maybe I'll do accordingly. So, is there anything we can do to guess whether patient will want such a treatment? The body language, the observation, the communication, and knowing where to start, knowing where to stop. Then should our charges be natural filter? Yes, once your practice goes beyond, you're not delegating enough in that regard, or you don't want enough of crowd, then price is one of the biggest filter in a flourishing practice, not in a struggling or a survival practice. We put it in 3 bars. There are multiple classifications, but I put it 0 to 3 are the struggler phase, 3 to 10 are the stable or the stable or survival phase, and after 10 are the, you can say, flourishing phase or settled phase. or the stable phase, or whatever you can say. So for a flourishing practice, yes, charges is the natural filter. Since people are aware of it, the system is there and automatically they'll be filtered out. But for a struggling or a survival stage practice, I don't advise that charges should be a natural filter. Now we started from here. Everything has a price. Nothing comes free in this world. Everything has a price. It's just what you are willing to pay for it. And trust me, when the patients need to pay for a cost, for a service, they know they'll get the reciprocating care from you in that regard. At the, you can say, end of 5 years after your treatment, nobody remembers how much they paid for. Nobody remembers what kind of crown they had, what kind of treatment they did. They only remember what kind of pain you gave them. And pain is directly associated with the care factor. So you need to understand the pain and the care part and the otherwise care. You can say how you handle the emergency, how you handle the patient post-op, how you handle the patient during the procedure. Those things are more important than anything else. I don't think वो care part में कहीं भी price fit होता है. अगर वो fit होता है तो then you can say measuring everything with the lens of price, which is a wrong thing to do. So price will always be imperfect for some. If an average price for a procedure in the market in your area is 2,000, you are doing it for 1,800, for example, somebody would find 1,000 also a overprice for that 2,000 base treatment. And somebody would happily pay 4,000 for that 2,000 price treatment also. So it will always be imperfect for some, more for some, less for some. So we need to figure out the right balance. The day you feel your brand has been created, you're getting steady referrals, it is the time that you obviously, you can say, upscale yourself and raise your charges in that regard. Healthcare के मामले में कोई search नहीं करता है कि what is the, let me search the cheapest endodontist, cheapest root canal specialist in my town, in my area, in whatever area you are in. Nobody searches. बाकी चीजों में कर लेंगे, हेल्थ केयर में कोई नहीं करता. ये हमारा माइंडसेट है कि लोग सस्ता चाहते हैं. वो सस्ता चाहते हैं क्योंकि आप सस्ते दिखते हो. अगर आप सस्ते नहीं दिखोगे, आप सस्ता ऑफर नहीं करोगे, तो आप सस्ते नहीं रहोगे. Everything comes at a price. As I always say, the final choice lies with you. Nobody can tell you to increase or decrease, but whatever you wish to charge in your practice, it lies down to you. So the price should not be just a tag. It should be one of the factors of the top 5 factors. It is already that one of the top 5 factors the patients choose you, but it is never ever in top 3 of why the patient chooses you. So I hope I have stressed up enough on this, and I hope Dr. Shrikant, your query has been answered as well. So if I put you all in the think mode, do let me know. I'll be really eagerly waiting for your feedback. And of course, Japnam as my favorite web series, Ashram is. So thank you so much for watching. These are my WhatsApp groups. If anybody of you is not in there and wants to be added, let me know. These are ad-free groups, and I plan to limit them till 6 only. And the 6th group is very much near completion. So this is my YouTube channel. There are lots of videos for the dentist. Again, one of the other ways of payback of, you can say, my payback to the society. So do subscribe to the channel if you have not already. I keep on posting minimum 2 videos every week. So do send me your feedback wherever you're watching, on the FB page, on the group where I'll be sharing, or on YouTube, or WhatsApp group where you are. Do send me your feedback. Bouquets and brickbats both would be welcome in equal measure. Thank you so much once again. And I stopped my share for acknowledging visitors on my FB page and taking up any queries if there are any. So hello, Dr. Ramchandra sir. Hello, Dr. Parul. Hello, Dr. Manu. Good evening. Hello, Dr. Abdullah. Hello, Dr. Mohit. Hello, Dr. Vanita. Hello, Dr. Vandana. Hello, Dr. Nadeem. Hi, Rajat. Hello, Dr. Sanyukta. Hello, Dr. Gunjan. Hello, Manendrajeet. Hello, Ananya. Hello. Thank you, Dr. Ramchandra sir. Hello, Alfan. So, thank you, Dr. Parul. I hope little sessions like this can motivate each one of us who are stuck. Many of us are stuck in that mindset theory that only the price makes the patient, you can say, choose a dentist or whatever you can say. So I hope uh, it makes some difference in your life. If it does, do let me know, because this is the aim only, that we all keep on improving continually each day we should be a better version of ourselves. Our competition is not with our neighboring dentist or anyone else. It is with ourselves of on the same day of the previous year. Thank you so much. Thank you, Dr. Nidhi. No, I'm not a legend. I'm just a human being, just with different fundas. Thank you, anyways, for your kind words. So, with this, we meet next on Thursday. Thursday is, you can say, Holi as well, which is, you can say, जलाने वाली होली उस दिन है, लेकिन खेलने वाली Friday को है. So Thursday we'll be taking up as usual on time one of the topics on finance, the 11th episode. So as we have planned for 26, we'll be going till mid June for 26 episodes. Mid of year, I mean, not mid June, mid of year. You can say the mid of or 30th of June, I mean, sorry. So thank you so much. Bye bye. Take care. Have a great week ahead since it is a Monday today. Bye bye.